Have you ever, even in the quietest corners of your mind, asked yourself, am I enough? Enough to make her happy? Enough to finally feel confident? Enough to stop worrying about size altogether? If that question has ever crossed your mind, even once, you're not alone. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. I'm Dr. Masha, a urologist who's walked alongside thousands of men in their most personal health journeys. And today, we're going to have a real, respectful, and honest talk about one of the most misunderstood subjects in men's health, penis size, and what women actually need to feel satisfied. By the time we're done, you'll leave with 3 powerful truths. First, how size really plays into satisfaction. Second, what most women care about far more than length or width. And third, what to focus on instead so you can feel confident in your own skin at any age. Let me start with a story that may sound surprisingly familiar. A few months ago, a patient named Darren came to see me. He'd been married for 35 years, deeply in love with his wife, and was by all measures a confident, successful man. But one late night of aimless online scrolling had planted a seed of doubt that shook him. "Dr. Masha," he said, "I've been reading that the average size is over 6 inches, and I've never measured that much. I'm worried I've been disappointing my wife all these years, and she's just been too kind to tell me." Darren's story shows one of the biggest challenges I see in my office: the massive gap between what men think is normal and what is actually normal. The medical reality, based on careful measurements from thousands of men, is that the average erect length is just over 5 inches, not 6, not 7, not 8, 5. When I told Darren this, I saw his shoulders drop like a weight had been lifted. But then he asked the question at the heart of today's talk. "But doctor, what do women actually want? What do they need to be satisfied?" That question led me to dig deep into the research. And what I found was both surprising and comforting. The gap between what men imagine women want and what women actually say they want is enormous. Most men assume women prefer much larger sizes than they truly do. And most men have no idea just how satisfied women already are with their partners. Here's where it gets fascinating, and maybe even a little mind-blowing. In one of the most comprehensive studies ever done on this topic, researchers didn't just ask women to imagine different sizes. No, they went further. They created life-sized 3-dimensional models that women could actually hold, look at, and evaluate in person. When asked to choose their ideal size for a long-term partner, the average woman picked one that was 6.3 inches long. Now you might be thinking, well, that's still bigger than average. And yes, technically it is. But here's the detail that changes everything. 20% of the women in the study chose not to state any size preference at all. That means 1 in 5 women essentially said, "This matters so little to me, I don't even have an opinion." And the most revealing part, it wasn't about preferences. It was about satisfaction. When researchers asked women about their actual relationships, 85% said they were satisfied with their partner's size. 85%. Meanwhile, when men were asked how satisfied they were with their own bodies, only 55% said they were happy. That's a 30% gap, meaning millions of men are quietly worrying about something that isn't even a problem for their partners. I see this all the time in my practice. Men come in convinced they need to change something physical, while their partners are at home wondering why their husband or boyfriend suddenly feels distant, self-conscious, or hesitant about intimacy. From a medical perspective, here's the reality. The range of normal is far wider than most people realize. The only size-related condition we actually consider medically concerning is called micropenis, defined as less than 3 inches when fully erect, and that applies to less than 1% of men. Everything above that, even if it's on the smaller side, is still medically normal. What surprises me most? How many men seek treatment for something they think is a problem when, medically, there's absolutely nothing wrong. I've had perfectly average patients ask about surgery or risky treatments, all because of insecurity. And here's something you might not expect. In all my years of listening to couples, I've never had a woman complain that her partner was too small if he was within the normal range. But I have heard women voice concerns about partners who were too large because it caused discomfort or made intimacy challenging. The truth is, the human body is built for compatibility. Women's anatomy is wonderfully adaptable, but there are limits in both directions. Too large can be a real problem. Average, or even slightly smaller than average, rarely is. Which brings us to the most important point of this entire conversation. If size isn't the deciding factor in satisfaction, despite what so many men have been led to believe, then what is? What truly creates the kind of deep, lasting connection that leaves both partners fulfilled and happy? After more than a decade of listening to couples talk about their intimate lives, one answer rises above everything else: communication. Time and again, the most satisfied couples are the ones who can speak openly about their desires, concerns, and needs without fear or shame. Think about it. Intimacy isn't a one-person performance where you deliver something to your partner. It's a team effort, a collaboration where two people work together to create something beautiful. And like any good collaboration, it takes conversation, patience, and paying close attention to each other. I'll never forget one couple who came to see me together, a rare but eye-opening experience when it happens. The husband was convinced he wasn't satisfying his wife physically, and the worry had grown so heavy that their intimate life had almost disappeared. But when I turned to his wife and asked directly about her concerns, she looked genuinely confused. "I don't understand why he thinks there's a problem," she said. "Our intimacy was wonderful until he started worrying about this. The only issue now is that he's so stressed and distant we hardly connect anymore." That story says it all. When men get caught up in measuring themselves, literally or figuratively, they often stop being present. They focus so much on what they think they should be doing that they forget to notice what their partner actually wants and needs. And research backs this up. Women consistently report that emotional connection, feeling truly desired, being appreciated, and having a partner who prioritizes their pleasure matter far more than any physical measurement. The happiest couples are the ones where both people feel heard, valued, and genuinely cared for. Now, if you're in your 50s, 60s, or beyond, there's something here that's especially important. With age comes change, yes, in our bodies, but also in our understanding of what intimacy means. And many couples I see who have been together for decades have some of the most fulfilling, intimate lives of all. Not in spite of aging, but because of the deeper wisdom, comfort, and connection they've developed over the years. They've discovered that intimacy isn't about meeting some outside standard or matching a scene from a movie. It's about connecting with the person you love in a way that feels real and meaningful. Of course, our bodies change over time. Hormones shift, response times slow. Things that once happened automatically may now require a little more patience, a little more creativity. But these changes don't have to reduce satisfaction. In fact, many of my older patients tell me their intimate lives became more rewarding once they embraced quality over quantity, emotional closeness over mechanical performance. There's something incredibly freeing about reaching a stage in life where you realize those glossy magazines, movies, and endless online advice were never showing reality in the first place. They were selling a fantasy, real intimacy, the kind that keeps couples happy for 40, even 50 years, looks nothing like that. The men who navigate aging best are the ones who understand that being a great partner has always been more about attentiveness, affection, and emotional presence than about physical stats they can't control. These men often discover their relationships deepen, their connection grows stronger, and satisfaction soars when they let go of unrealistic expectations and focus on what truly matters. Some have even told me that the most meaningful moments of their lives happened in their 70s or 80s, when they finally stopped worrying about measuring up and started focusing entirely on the joy of loving and being loved. So, what does this mean for you in a practical sense? How can you take everything we've talked about and actually use it to build confidence and strengthen your relationships right now? First, understand this. Confidence is far more attractive and far more satisfying to your partner than any physical trait could ever be. When you feel good about yourself and approach intimacy with joy instead of anxiety, that energy spreads. Your partner relaxes. You both enjoy the moment more. It becomes a positive cycle that keeps building. If you've been holding back from intimacy because you're insecure about your body, consider this. Your distance and withdrawal may be creating more strain in your relationship than whatever you're worried about ever could. Most partners would choose an enthusiastic, attentive lover who feels average about his body over a distant, anxious one who happens to be exceptional in size every single time. Second, start improving communication now. Don't just assume you know what your partner wants or needs. Ask. And keep asking. Make it an ongoing conversation. Questions like, what feels good? Or, what would you like more of? Or, how can I help you feel even more connected to me? Are not awkward. They are the building blocks of a great intimate life. Third, take care of your overall health, because it impacts intimacy far more than size ever will. Move your body regularly. Eat in a way that fuels you. Manage stress. Get good sleep. Address medical issues early. A healthier body doesn't just work better, it feels better and gives you the energy to be fully present with your partner. And fourth, focus on giving pleasure rather than obsessing over performance or appearance. When you shift your attention to your partner's enjoyment, incredible things happen. You become less self-conscious, more in tune, more skilled. Your partner feels cherished and prioritized. And the irony? You often find your own satisfaction increasing when you stop making it the main goal. Let's talk for a moment about when it makes sense to seek professional help, whether that's medical care or counseling, because there are absolutely times when outside support can make a huge difference in both your confidence and your relationship. From a medical standpoint, if you're noticing changes in how your body functions, difficulty achieving or maintaining erections, decreased sensation, pain during intimacy, or any other unusual symptoms, it's worth bringing up with a healthcare provider. Many of these issues have straightforward treatments, and addressing them early can have a powerful effect on your confidence and your connection with your partner. If your worries about your body or performance are creating anxiety that's affecting your quality of life or your relationships, it's wise to consider speaking with a counselor who specializes in intimacy and relationships. This isn't weakness, this isn't failure, this is wisdom. Just as you'd see a doctor for a physical concern, it makes sense to get professional guidance for emotional or relationship challenges. Couples counseling, in particular, can be a game changer if you and your partner are struggling with communication or if intimacy has become tense or distant. A skilled therapist can help both of you express your needs and concerns safely while giving you practical tools to reconnect and rebuild closeness. The key is understanding that seeking help shows you care about your relationship, about your partner, and about yourself. In my experience, the happiest couples are the ones who don't let problems fester. They address them directly and early, instead of hoping they'll just fade away on their own. As we wrap up this conversation, I want to leave you with the single most important message in everything I've shared. You are enough exactly as you are. The self-doubt and quiet anxiety so many men carry about their bodies are built on myths, not medical truth. The research is clear. The medical evidence is undeniable. And my own experience working with thousands of men confirms it. Satisfaction in an intimate relationship has far more to do with emotional connection, honest communication, and mutual care than with any measurement on a ruler. Your partner didn't choose you and doesn't keep choosing you because of numbers on a tape measure. They chose you for the way you make them feel, for the love and presence you bring into their life, and for the moments you create together. So focus on being the partner who is present, attentive, and caring. Take care of your health, your communication skills, and your emotional availability. Those are the qualities that make relationships thrive over the long haul. If what we've talked about today has helped you feel even a little more confident or shifted how you see yourself in your relationships, I hope you'll share it with other men who might need this message. Too many good men are quietly suffering from insecurities that have no basis in reality. Remember, the goal isn't perfection, it's connection. It's not about measuring up to some impossible standard. It's about showing up fully for the person you love, and you already have everything you need to do exactly that. Thank you for trusting me with this conversation. Until next time, take care of yourself, and remember, you matter.